Okay, this is Lydia, and I'm gonna try and demonstrate how to do an IVC placement with this image here. So we are doing an IVC on a front limb, and I'm gonna talk about all steps involved in doing so. So, you know, with any procedure, you're going to want to gather supplies, and get an area ready if you anticipate on having to place this. What you're going to need is a restrainer, a pair of clippers with a size 40 blade, gloves, chlorhexidine solution for scrubbing the IV site, alcohol for scrubbing the IV site, a 20 gauge intravenous catheter, and we want to use a 20 gauge because for the most part we're going to be using 22 gauge needles to give, you know, either injections or fluids into that catheter, so you want your catheter size to be bigger than the needle that you are injecting with. So after the 20 gauge IVC, you want a catheter plug or cap, as well as medical tape and some rinse to flush your catheter. So first, you should always have your supplies listed above ready, including having your tape already pre-torn. You're gonna have one piece torn in half. The length of this really depends on your patient. So if you have a smaller animal, you're not going to have as long of a piece of tape. It looks like we have a golden retriever here, so you're probably going to need a decently long piece of tape. If you rip off too long of a piece, you can obviously just get rid of that at the end. And then so you have your two skinny pieces, and then you're going to have one piece that's the same length that isn't ripped down the middle, but it's ripped towards the end to create a notch. And we will talk about that later. So we have our tape pre-torn. Our intravenous catheter is open but not completely out of the packaging to keep sterility. You may remove your stylet end cap prior to or after placing your intravenous catheter. So that end piece, if you don't have it loosened or off, you're not going to get a good flash when you do initially place that. You know, that flash is kind of a good indicator to have to ensure that you're, in the right spot. So you want to have your intravenous catheter plug or cap already open, but again remaining in the package for sterility. And secondly, you do want to, read all your patients before you do anything to them to make sure you are expecting, how they're going to react. And you want them to be calm and quiet during this. You don't want them to jerk or suddenly move during this. That would be bad. To execute this well, you need to have some good communication with your restrainer. I wouldn't talk too loud or try and stay calm with that communication. You want to have your restrainer hold your patient in sternal recumbency, which it looks like our patient is in here. And this will help you isolate the cephalic vein on one of the front limbs. So cephalic vein is going to be, in this general area, between the carpus and the elbow, under the skin on the cranial surface of the front limb. So you are going to shave your patient's front limb in this area where you expect the cephalic vein to be. So you're using your clippers with that number 40 blade. And you want it to be, an even spot. You want to make, some nice lines around the leg. So you're probably going to shave from here, to here. From here to here. And I'm expecting this dog to have, that feathery fur coming off the end here because it does look like a golden or a lab. And you want to trim those as much as you can, or even just shave completely around the leg to ensure that your tape isn't getting caught, and it'll just go easier for you with the less hair that you have. This also helps with contamination and keeping sterility. So once you have done so, feel around that area. You shave to see if you can feel the cephalic vein, which I said is going to be here. A lot of the times you're going to see that blue vein just right there. It's going to be kind of bright as day, but in a lot of situations you're not going to see that vein right away, and you're going to have to feel it. And that's the best way to feel a vein. Even if you can't see it, it's always good to feel it. See where it bifurcates. You're going to want to go above that bifurcation. That's where you're going to want to place it. So So once you have done so, and you've visualized that cephalic vein, you can visualize the bifurcation like I said, and you'll want to administer the IVC proximal on the leg to that bifurcation like I said. So once you've felt the vein and you have good visualization, start to prep the site aseptically using chlorhexidine and alcohol scrubs alternating. So you're going to want to have your gloves on at this point. You're going to have your chlorhexidine and alcohol. So you're going to start with chlorhexidine, doing concentric circles around the area that you are going to be, anticipating placing. So this is where I'm going to place it. I'm going to start here, do concentric circles, working my way all the way out, and throw that out. And then you're gonna do alcohol, same thing, concentric circles out, making sure you're not bringing any debris towards the middle. And you're gonna do that 3 times. You're gonna do a repetition of chlorhexidine, concentric circles, followed by alcohol, concentric circles 3 times, and you are gonna let that sit on your patient and maintain contact time for 3 to 5 minutes before you even, try to place your intravenous catheter. Okay, so we have done our chlorhexidine and alcohol scrubs, and we said we're gonna leave that on for 3 to 5 minutes to ensure accurate or good contact time. So once you've sufficiently prepped this IVC site and you still have your patient's cephalic vein visualized, you may begin the catheter placement. So you want to communicate with your restrainer to then hold the vein off and that you are about to administer. So what you want to have your catheter out of the packaging at this point. Everything's ready to go. Your end is loosened. You've broken the seal. So you want to have your bevel facing up, and you do want to angle your catheter downwards at somewhat of a 45-degree angle. That is going to allow you to puncture the skin and avoid going too superficial to the vein. So you are going to want to do this. You have your angle, you've punctured. So you're puncturing the skin deep enough to enter the vein, but not too deep to puncture completely through the vein. So you have your angle, you're puncturing, and you see that first flash. You want to start feeding your catheter into that vein until it can't go anymore. You want to start pushing it off the stylet. Once the catheter is in the vein as far as it can go, you can remove the stylet completely. While doing so, you should be communicating with your restrainer to let off, holding the vein once the catheter is placed. And so then they can move their hand from holding off the vein to holding the catheter in the vein. So, our catheter is placed here. They're going to bring their hand on and put their thumb, right where that catheter is in the vein, to hold it off from bleeding while you try and get that catheter plug on the opening of the intravenous catheter. And you are still maintaining aseptic technique at this point. And you don't want to keep, take your hand off of the catheter at any point until that cap is on. And until the cap's on, you don't want to put your thumb on the opening of the catheter that's outside of the pet's body at this point, because that is not aseptic if you touch that without the cap on. So while keeping your thumb on the end of the catheter at all times, as long as your cap or plug is in intravenous catheter, you may now reach for your first piece of torn tape, which you will place sticky side up. So we're going to take our, one of the pieces of tape that is split in half. It's going to be sticky side up. You're going to put it right underneath where that catheter is going in to your pet's leg. So, the sticky side is facing up. It's going to grasp onto that catheter, and you're going to actually wrap it around. Whoop, and so it's securing the catheter onto the leg, and you're going to wrap it around the leg to secure it. So now, it's secure. You can take your hand off the catheter. You may want to keep your thumb on until you get that other piece of tape on, just in case. But once you have this first piece of tape on that is securing it to your patient's leg, this is when you want to use your flush. So you're going to administer your flush. You're going to take the needle off using, OSHA standard rules. Place the needle in the cap of the catheter. So you're in the catheter plug. You're going to draw back to ensure that you're getting blood, and that shows you that you're in the vein. And then you are going to flush the catheter and the vein. So you're going to push on the thumb rest of your syringe that contains rinse after you've aspirated, and you're gonna inject a few, a cc or a cc and a half, and you're doing so to flush the catheter and to ensure that you're in the vein. You want to check for any swelling that might happen. Once you do this, that will indicate that you've punctured through the vein and that there is liquid leaking out of the vein, and that would mean you would have to do it again. So we just flushed because we did our first piece of tape. So after the flush of your catheter, ensuring that it's placed within the vein, take your notched piece of tape and place that notch under the catheter port. So where we just injected that flush, that notch piece is going to, is going to go right at that catheter port, sticky side down to our patient, and that notch piece is going to slip, over where our catheter is, and it's going to lock our catheter and that piece of tape that's underneath it in place. Okay, and then so we did our notch piece, and we're bringing it over the lateral sides of the IVC to make it more secure. Then loop your tape around the forelimb. So we've secured it. You want to loop your tape around again, and you're covering that top part to make sure that that is not exposed. But we also did that with that first piece of tape. So you can add an additional piece of tape after this, crisscrossing over the IVC port. So you could do sticky side down again, and then kind of just wrap it around the port, and then the leg, same over here, you're gonna wrap so it makes like a little crisscross action there. And then, so you wanna leave a window when you do this, because your port, so we did our little crisscross, so sticky side up, we did a crisscross over the port. It's secure, but that cap is clear, and you want to make sure you're not putting your tape over that because you want to see it for troubleshooting and of the such. So yeah, that is how you do a catheter placement. And I mean, even after you do that final piece of tape, you might even want to flush it again to make sure that it didn't come out or anything when you were taping. So yeah, that's IVC catheter placement.